State. Good afternoon. I am Katy Tur, not just because it is my hometown. It's 2 p.m. in the east and 11 a.m. here in Santa Monica, California, my hometown specifically. This state is the biggest prize on Super Tuesday. And now with Amy Klobuchar dropping out of the race and endorsing Joe Biden, we're wondering how many delegates does Joe Biden stand to gain? In the past few days, everything has been coming up Joe Biden. A giant win in South Carolina, $10 million raised. Pete Buttigieg dropping out and implying support for him. And now the other moderate in the race, Amy Klobuchar, dropping out and actually endorsing him. It has put Biden in a position to own the anti-Bernie lane on Super Tuesday. But the one big wild card is still Michael Bloomberg. Joining me now on the phone, NBC News correspondent Mike Memoli and NBC News political reporter Ali Vitale, who has covered the Klobuchar campaign. Ali, first I want to go to you. How was this decision made?
Katy, I think for a lot of people, the pressure was really mounting. We knew these 72 hours between South Carolina and Super Tuesday were going to be so crucial. What really ended up happening, though, is that throughout these early contests, we saw Joe Biden having middling performances. And for a lot of these other candidates who were trying to compete to be the Biden alternative, Pete Buttigieg and Amy Klobuchar specifically, they were able to find some footing in that. What happened after South Carolina was Joe Biden showed that he's got a lot of fight left in him, and it left a lot of these candidates who happen to be younger and could be the future of the Democratic Party wondering what to do with their presidential prospects. For Amy Klobuchar, if you just look towards Super Tuesday, she's got a home state that's on the map there. When I talked to her after that debate in South Carolina last week, she was bullish about her chances there, telling me that she thought she was going to be able to win in her home state. But if you just look at the polling there, Bernie Sanders is close on her heels in Minnesota. She's someone who consistently has warned against the dangers of a Bernie Sanders nominee. It makes sense that she's dropping out and endorsing Joe Biden. But at the same time, it is a little bit surprising to see which of these candidates are doing the calculus of staying on the ballot until Super Tuesday or dropping out beforehand. For Amy Klobuchar, dropping out on a staff call with her team just a little bit ago. And of course, this news coming into us, it seemed a little bit spontaneous, but Amanda Golden and myself confirming that Amy Klobuchar is out of this race. And really one of the more moderate candidates here who was regularly talking about the need for more moderate positions on things like health care. Those were the things that made her stand out in this race. She had a strong debate performance that catapulted her in New Hampshire, but at the same time, the delegate realities and the map realities were coming in hard on Super Tuesday, and I think a lot of that is what fed into this decision now, Katy.
Ali, don't go anywhere. I've got 3 more questions I want to ask you, but I do have to get to Mike Memoli first. Mike Memoli, as we said just a moment ago, everything seems like it's coming up Joe Biden. The win in South Carolina, all of that money raised. Pete Buttigieg now out of the race. Amy Klobuchar out of the race. That being said, it is there's almost no time between now and Super Tuesday tomorrow. So many people have already cast their ballots, especially here in California with early voting. All of that money he was able to raise after the win in South Carolina, he didn't get it fast enough to put it to use for the Super Tuesday states. That being said, what is the Biden campaign doing right now?
Well, Katy, I mean, first of all, let's talk about where we were just a week ago with the Biden campaign. We had a new poll at the time that showed South Carolina as a single-digit race between Joe Biden and Bernie Sanders. And there were a lot of folks in the Biden campaign who wondered if they'd even have a Biden campaign at this point, let alone be in the position that they find themselves in now. But we did obviously see this rush behind him, not just with a number of congressional endorsements and Senate endorsements coming his way just today, but now obviously these former candidates dropping out of the race, and in the case of Amy Klobuchar announcing her support. It really is an indication. I think part of the strategy here, which we shouldn't overlook, is, as you mentioned, Joe Biden was not in a position to necessarily capitalize on all this momentum tomorrow because the money is coming in too late. So much of the early vote has already been banked. But what these announcements effectively do is allow the Biden campaign after tomorrow to say, yes, we didn't win everywhere, and Bernie Sanders is able to pick up, significant delegate advantage, but we all know where this race is heading at this point. They believe that the map gets a lot friendlier to them, and certainly the pressure is going to continue to build on Mike Bloomberg at this point to stay in the race or consider joining what is the rush to get behind Joe Biden at this point. So effectively, even if the Super Tuesday results aren't as good for Joe Biden as they looked in South Carolina, it gives the Biden campaign the ability to say, you can brush them off to some extent because we're in a delegate race now with Bernie Sanders and Joe Biden alone.
And the reason for Mike Bloomberg to get in this race was because that team and Mike Bloomberg himself did not feel like Joe Biden was strong enough to win the nomination. I wonder if that changes the strategy behind the Bloomberg campaign after tomorrow night, because obviously they've been on the air now for a couple months, spending millions and millions and millions of dollars. It'd be hard to believe that they would get out before tomorrow night, but stranger things have happened. Ali Vitale, you've said this on Twitter, and I would like you to expand on it on the air. Is it safe to assume that all of Amy Klobuchar's voters or all of Pete Buttigieg's voters, just because they are moderate like Joe Biden, go to Joe Biden?
A very lawyerly question, Katie, because you're asking the question you already know the answer to, which is something I tweeted yesterday and something that you've heard on the campaign trail too, which is that voters don't go by lanes. They're not going by lane logic when they consider their next choice. Across the board, if you look at second choices, and there are several polls which may or may not be reliable at this point because South Carolina yesterday changed the calculus so much in terms of the Joe Biden surge, but so many voters who might have had Amy Klobuchar or Pete Buttigieg as their first choice, polling would show that the breakdown says that some of them like Elizabeth Warren, some of them like Bernie Sanders. However surprising that is, given that Bernie Sanders has very different policy proposals than Pete Buttigieg and certainly Amy Klobuchar. But it sort of just goes to show you that just because you see one candidate dropping out doesn't mean that their support goes to the next logical person. And I think, frankly, if I can speak to the Elizabeth Warren logic in their campaign talking about being in for the long haul, Super Tuesday has always been the strategy for them. They think that they have a good chance of being viable across a lot of these congressional districts. That doesn't necessarily mean, and certainly they're not saying, that they're going to win these states outright. Even that's true here in Massachusetts, where I am, her home state. Bernie Sanders certainly given her a run for it. But at the same time, the Warren campaign feels like they're in a bit of a different position because they see polling that shows them as a consistent second choice for a lot of these other campaigns that are in the race. So as they drop out, I think that's one of the realities for the Warren campaign to be looking at, is where the second choice support can go. And frankly, they now have the money, over $29 million raised in February, to keep them going and to keep funding their operation. So much of the conversations that you and I have had over the course of the last few weeks are the will to stay in and the way to stay in. Of course, so many of these candidates, when you run for president for more than a year, you want to stay in, you want to run through the tape and let people have the chance to vote for you. But then there's the actual way to stay in. Do you have the dollars and cents to keep funding this operation? And I don't know what the money looks like on the back end. We'll see these campaign finance reports at the end of the month. But at the same time, for the Warren campaign, they now have both the will and the way to stay in. So as we watch this coalescing around Joe Biden, I think the thing to keep in mind is the fact that the Warren campaign always wanted to be the third way alternative. There was Biden in that quote unquote moderate lane. There was Bernie in the progressive lane. Warren wants to go between the two.
Ali Vitale answering all of the three questions I had for her on this back end in one answer. Ali, thank you so much. And Mike Memley on the phone, thank you as well. Here now on set with me now in Santa Monica is Los Angeles Mayor Eric Garcetti. He has endorsed Joe Biden for president, and chair of the California Democratic Party Women's Caucus, Christine Pelosi. Her mother, as you may know, is House Speaker Nancy Pelosi. Guys, welcome. Mayor Garcetti, I'm going to start with you because everything's coming up Biden. You endorsed him. Yep. Do you think lots of early votes have been cast? Do you think that these two candidates, Klobuchar and Buttigieg, dropping out changes things here from what you've experienced?
Well, it certainly helps, and we've seen a lot of evidence that a lot of people were still holding back here in California, lower numbers than usually at this time because it's been so dynamic. But as Joe said, this is about anybody's ever been counted out, anybody's ever been an underdog. That's America. That's Joe's story. That's America's story. We feel that momentum. We feel the money. We feel the momentum. But it's still an incredibly dynamic race, and I completely agree that people aren't just in one lane or the other. Joe's not just a moderate, he's a progressive. There's people who like Bernie and like Joe. But we're feeling here in California, I was just in Texas in 3 cities, a lot of surge, a lot of momentum, a lot of people going back to the heart of the man that we all know, and there's nobody has a bigger heart than Joe Biden.
Christine, what do you think about Michael Bloomberg? On Saturday, when he won South Carolina by a very large margin, I talked to somebody in the Bloomberg campaign who said they were not impressed with it. He has not done well so far, and they were not getting out of the race. Does that still stay the same?
Well, Super Tuesday is going to be really exciting for California. We have 415 delegates up for grabs here. A lot of my members in the Women's Caucus are all over the map. We really want to vote for a woman, so I think that Liz Warren will get a lot of votes from those who haven't turned in their ballots already. There was also a lot of support for Amy, for Kamala, of course, once our mayor here didn't run, and also for Pete Buttigieg. So I think when you're looking at people who are holding their ballots, like me, making a decision tomorrow, really coming down to Bernie or Joe or Liz as really our top three, because we know them the best and they've connected with us the best. And I think that with Bloomberg, what he's learning is it's one thing to campaign in New York City. It's another thing to campaign in the National Democratic Party, where women, especially women of color, are going to be the heartbeat of this race. And right now, they're not going to Bloomberg.
What is your sense of where women of color are going in California?
Well, they're telling us that they're going, 80% of the people haven't turned in their ballots yet. So it will be something to watch over the next few days. And as you know, it takes 2 to 3 weeks to count the ballots in California. And so it'll be a while. But I think I'm going to be looking to my sisters to see, where are you? What are you doing? Who do you still like? A lot of people liked Kamala Harris and were very upset that the financial constraints that led to her dropping out early and not being able to compete tomorrow. A lot of people really are impressed that Bernie Sanders went deep into black and brown communities this time and has really tried to do some on-the-ground organizing. So I think you're going to see 3, possibly 4 people get delegates. And it's important to note it's a very long race, as the mayor said. So we shouldn't expect this to be over for several months.
Former Senate Majority Leader Harry Reid has just endorsed Joe Biden. Mayor Garcetti, Bernie Sanders has made a lot of inroads in California. And you look at the polling, and God knows if the polling is right or not, Bernie Sanders is demonstrably in the lead. And I think part of that can be attributed to what you see when you just walk around the streets here in California. Homeless people living on the street in front of million-dollar houses. He's done a lot to address inequality. How does Joe Biden eat into that?
Well, it's great to see Bernie focus on that, but Joe Biden also has in his housing platform probably the most aggressive way to address inequality, which is to make Section 8 vouchers universal, to look at ways that we can get home ownership. He's been in communities of color, so they don't have to be introduced to him for the first time. We saw that in Alabama yesterday, the countless states that he went into campaigning, showing how strong he is across this country. I think, this idea that he's a moderate, to me, I've never understood. I endorsed him as a progressive because Joe Biden is a progressive who delivers progressive.
Is it just that he's moderate in comparison to Bernie Sanders and Elizabeth Warren?
No, I just think it's something that's been tackled onto him over these years because people who are the analysts say that. But if you look at what he's done, he helped me raise the minimum wage here in Los Angeles, the largest city in America to do it. His wife helped me make community college free, the largest city in America to do that. He knows how to accomplish progressive ideals, not just to talk about them, but get them done. And I think that's beginning to finally resonate.
The wind blew that umbrella away. I want everyone to know out there that it did not hurt anybody. Everyone's fine. It's the kind of day that makes you feel like using an entire can of hairspray, as you suggested earlier, might be a good idea. One last question about down ballot races. There's been talk among Democrats that Bernie Sanders would not be good for down ballot races, and the examples that are used are the 2018 races. And if you look at the spate of candidates that won, Democratic candidates that ousted Republican candidates, they were more moderate. They were more like Joe Biden than they were like Bernie Sanders.
Well, they were like themselves. And one of the things that Nancy Pelosi has always said is your job title and your job description are one and the same. You're already a great
politician.
Representative. So this pin I have on of my mom is from the White House meeting that she had in 2018 after being nominated for Speaker by 90% of her caucus. Donald Trump was still taunting her. You'll recall he wanted a wall in exchange for ending his shutdown. She said no. He said, Nancy can't really talk right now. She said, please don't characterize the strength I bring, as the leader of the House Democrats who just had a great victory. And then she walked out, put on her shades into meme history. So if she had 90% of the vote and he was still taunting her, rest assured, Donald Trump is going to taunt Bernie Sanders. He's going to taunt Joe Biden. He's going to taunt Liz Warren. He's going to taunt everybody. What Democrats have to do is focus on the grassroots, down to every blade of grass, focus on the fact that Donald Trump is still trying to sue and sabotage to end the Patient Protection and Affordable Care Act and try to get science, not stigma, into this coronavirus. That's what's going to help us win, and no one is going to be any more of a drag than anyone else.
Down ballot races are not going to be affected regardless of who's at top. I imagine you would say Joe Biden is better.
No, he absolutely is. I mean, I was in Texas. We're 9 seats from flipping the House of Representatives in Texas, and people are excited to have Joe Biden at the front of that ballot. They think they can make that history happen. We see that across across America. It's great to see the enthusiasm, too, that Bernie's bringing out. No taking away of that at all. But I think in some of these marginal areas where we finally flip the House, where we can win the Senate, Joe Biden is an American we can trust.
Mayor Garcetti, thank you so much for joining us. Always good to see you in person.
Home.
Christine Pelosi, thank you. Good to see you and good to meet you. Awesome pin. A second person has died here on the West Coast from COVID-19, the disease caused by the new coronavirus. Washington state authorities say the man, who was in his 70s, had underlying health conditions. Over the weekend, a Seattle man in his 50s died after contracting the disease from an unknown origin. Officials in New York have disclosed the first confirmed case of the virus in New York City. A Manhattan woman is under voluntary quarantine in her home after contracting the virus following a visit to Iran. Governor Andrew Cuomo urged caution in a press conference earlier today.
80%, it'll resolve on their own. The woman who is now tested positive, she's at home. She's not even in a hospital. So the perspective here is important. And the facts, once you know the facts, once you know the reality, it is reassuring. And we should relax, because that's what's dictated by the reality of the situation.
Experts warn that we are going to begin seeing more reported cases as testing increases. And as they continue to show up in major metropolitan areas, Americans are understandably concerned, with one government official telling NBC News that the virus has reached likely pandemic proportions. Joining me now from New York City is NBC News correspondent Ron Allen, and from Kirkland, Washington, NBC News correspondent Gadi Schwartz. Gadi, I want to start with you. I understand the fatality numbers have changed in just the last couple minutes.
Yeah, just in the last couple of minutes, we're listening to this conference call right now with CDC officials and health officials here in Kirkland. And it appears as though in Washington state right now, there are 14 confirmed cases, 5 deaths. So a little bit earlier, you were saying 2 deaths. That's the latest numbers that we had until just moments ago, that on this conference call, they started going through the new cases that they've seen so far. And they listed some of the same cases that we've been following. They said that some of those patients have since passed away. But again, 5 deaths, a total of 14 cases here in Washington state. They've also been talking a little bit about the preparation that they want to do and the ramping up of testing. One of the things that they mentioned was that there are plans to buy a property that is a motel and house people at this motel. They're hoping to have that finalized. They didn't have details on exactly where that would be, but they were hoping to finalize it within this week. So by the end of the week, they should have some sort of motel where people can go and be treated for the coronavirus. This suggests that those numbers are going to increase as more testing kits come online. Again, only 14 cases confirmed so far, but there are hundreds of people that are being tested for the coronavirus. And we also know that there is a possibility that the coronavirus has been here spreading through 2 different communities for possibly 6 weeks. The first known case of coronavirus was right here in Washington state. It was back in mid-January. Then 6 weeks later, a high school student tested positive, and that positive test had some of the same characteristics of the first strain. So epidemiologists and officials are now tying all of this together. Again, 14 confirmed cases so far and 5 deaths. Katie, back to you.
So 14 confirmed cases, 5 deaths, as you've been saying. Do we know anything about those who have passed? Do they all have underlying health conditions? Were they older? Did they fit the description or the concern, the spectrum of concern that we've been hearing? Or are they younger? Are they out of the zone of concern, Gadi?
Yeah, so right now, the information is still developing, but we know that the majority of those 5 cases are elderly patients and people that had underlying medical issues, and many of them have been here at the hospital trying to recuperate. Some of them have lost that battle, unfortunately, and some of them were also linked to that nursing home that is now being the center of an investigation into a possible outbreak here in King County. But again, none of them appear to be young. They all appear to be elderly people with underlying medical conditions. We should have a little bit more information on that coming up. Katie?
a nursing home is the last place you'd want there to be an outbreak. Ron Allen, New York City has its first confirmed case. A woman is self-quarantining. What else do we know?
Well, she's a healthcare worker, and her husband was with her when they were traveling in Iran. He is being tested and expected to be positive, too, so there'll probably be 2 cases. It's unclear whether she was working in a medical capacity or just traveling there, but she got to New York Tuesday, we understand, and she felt ill, got tested, treated, and now she's at home, and they say that her case is mild, and they expect her to fully recover. Unclear how long that will take. As a matter of caution, though, they are also, health officials here, going back and trying to contact everybody who was on the plane with her from Iran back to the United States. And they're also contacting the driver of the car that brought her from the airport and anyone else that she thinks that she came in contact with during the past number of days that she's been here. So there's that level of vigilance. But, of course, this is just one case. You can't do that with everyone. So as Gotti was saying out west, here, they are also trying to ramp up testing. New York now has the ability to test itself, to get its own test results. That's only been the case for a day or 2. The governor set a goal of being able to test 1,000 people per day in about a week. Now, at this point, there's no demand anywhere near that. I think the numbers are several dozen people who have been tested and several hundred who are being monitored across the state. But that's what they want to do. That's where they want to get to so they can see just how bad this is and understand the problem and be prepared, but not panic. Katie?
NBC's Ron Allen and Gotti Schwartz. Gentlemen, thank you very much. And with me now in Santa Monica, Professor of Epidemiology at UCLA's Fielding School of Public Health, Dr. Anne Rimoin. Dr. Anne, there is concern that this is now out of control, that you cannot stop the spread of this virus, that people are going to get it. And there is real concern, obviously, about those who are particularly susceptible.
Well, I think that these are good points that you're making. Right now, what we know is that there is spread in certain places where testing has been able to be rolled out. And I think as we see testing rolling out further throughout the country, and we now know that several assays are in the process of being approved by FDA, then I think we're going to be seeing a lot more cases here. I think that this is something that is going to become much bigger over time.
We keep hearing, wash your hands. That's the best way that you can prevent this.
Absolutely. I mean, this is a disease that is highly contagious, and we need to be able to protect ourselves. Protection starts with individual things that individuals can do, and that is wash your hands regularly. Don't touch your face. Make sure that if you are in public places that you do these things regularly. Wash your hands. That is the best thing that you can do.
20 seconds. Make sure you get your fingernails.
Exactly.
Don't just run soap over your hands and rinse them off.
And 20 seconds is something that we really need to think about. What I always say is sing row, row, row your boat twice, or happy birthday to me or to you, whoever you want to say, twice. That's 20 seconds. And so really get your hands washed well, and yeah.
So in looking at the spread of this virus and also looking at politics, and there's a convergence because we're talking about healthcare a lot in the 2020 election, and there are a number of people in this country who do not have health care. Here in California, I think the number is around 7 or 8% of people who don't have health care. How does that affect our ability to contain a virus that is very infectious?
Well, it makes a very big difference. The issue is when people do not have health care, they are often less healthy, and they don't know where to go when they're sick. And so I think that this is something that's going to become a major problem, and there needs to be good messaging on where people can go when they are ill, or if they feel that they are ill, or who they can ask, and how the health system is going to be triaging these people.
There's also a question about billing. I mean, there are people who have gone in to get tested for coronavirus, ended up only getting tested for the flu because they wanted to be abundantly cautious, and they're going back home with a $3,000 medical bill. That's the sort of thing that I feel like would deter people from seeking medical help when they need it.
Certainly, but as the coronavirus test is now going to be widely available, this will not be at issue. There will be more rigorous screening for people coming in. We will have testing available to people on a much wider scale as time goes on, not right now. And I think that what's going to be coming up soon is there's going to be much more telemedicine. There's going to be availability of people to answer questions about whether or not people think they're sick. But the bottom line is, unless you are very, very ill, you don't need to go to the hospital. You don't need to go to the emergency room at this point. And I think that keeping the worried well and the worried not terribly ill away from hospitals and from taking up important resources that should be dedicated to people who are very, very sick is very important. Hospitals really, really are already at capacity in many, many places. It is the middle of flu season right now.
Yeah.
And so I think that this is where we can all do a much better job.
Stay home if you can, although those who don't get paid sick days, obviously harder for them to stay home when they're choosing between their livelihood and whether they might have an infectious disease if they don't feel that bad.
Absolutely. This is a very big issue.
Yeah.
What we tell people who can't stay home, try to distance yourself as much as you possibly can. Let other people around you know that you don't feel well. Cough into your elbow. Cover your mouth. We understand, but do the best that you can. If you can stay home and you don't feel well, that is the best thing that you can do.
Health insurance, paid sick days, all these things come into stark view on days like this. Dr. Anne Rimoin, thank you so much for joining us. We appreciate all of your expertise. And with me now on the phone from his quarantine at the University of Nebraska's hospital is Carl Goldman. Carl contracted coronavirus while aboard the Diamond Princess cruise ship with his wife. 700 cases of coronavirus have since been linked to that ship. Carl, I know we were trying to Skype with you, but unfortunately the Skype fell through, wasn't able to connect. How are you feeling?
I'm feeling great. I wish I was in Santa Monica with you, although I would have a bad hair day if I was there with that wind.
So you're feeling good. You have a sense of humor. Tell me about your symptoms.
So right now, all I have left is a dry cough that seems to get worse later in the day. You can hear my voice is still raspy. If I do a lot of exercising, I do get a shortness of breath. But I only had the virus for one day of a high fever, which I got on the plane after leaving the Diamond Princess. And then that spiked, lasted about 8-9 hours, and that was it. There's no antibiotics that were given me because none exist. So I've been having a diet of Gatorade and regular food, just trying to stay hydrated.
And you're still able to exercise?
Yeah, I've been downgraded. I was in a biocontainment room for 12 days. There, my exercise consisted of walking 10,000 steps a day, 7 steps to the wall, so that was a challenge. Now I'm in a lower grade biocontainment area here in Omaha. I have a stationary bike here, and I can walk 14 steps before hitting the wall.
Have doctors told you why they believe it hasn't affected you more heavily?
I believe, and I've seen this because 2 of our friends traveling with us got the virus. My wife did not. I think for 98% of the folks out there, it's less threatening than a minor cold. Now, I just heard your report of 5 deaths now, up to 5 deaths in Washington. We've had 6 deaths on the Diamond Princess. Most of those people were elderly and had some pre-existing conditions. So I think for the majority of folks out there, including me, it's like getting a mild cold. If I wasn't right now contagious, I would be back at work at the radio station we own in Santa Clarita, California, 2 days after I first got the virus.
Very interesting. Carl, a public health emergency has been declared at Travis Air Force Base in California. Your plane stopped at Travis before you were transferred on to Nebraska. That's also the site where the whistleblower said that government workers, government first responders, were not properly protected. Tell me what you saw when you went through Travis.
Sure. I was still on the plane at Travis. There were about 150 of us, all Americans, that had been transported from Tokyo, all of us Diamond Princess folks on the plane. We only, other than the pilot and co-pilot, we only had 3 Air Force personnel, an Air Force doctor, and 2 medical assistants. All were in hazmat suits. Now, on the plane, we probably could have infected each other, but we were all on the Diamond Princess, which became a floating petri dish with over 700 passengers contaminated. So the chances are we contaminated ourselves long before we got on the plane. At Travis, they let all the passengers off except 3 of us. And then our spouses stayed on, and the 6 of us traveled to Omaha. So I just think that you have a lot of people at Travis who had already been exposed to the virus from the Diamond Princess.
Very interesting. And interesting that you said that all the government personnel that you encountered were wearing hazmat suits. Carl Goldman, thank you so much for joining us, and feel better out there. Good luck.
Thank you so much.
This is kind of a funny sentence to read, but bear with me. We are sitting in Super Tuesday's biggest prize. California is a key battleground in the 2020 Democratic primary. There are 415 delegates at stake in this single state. If polling is your guide, Bernie Sanders has a sizable lead here, but Joe Biden is riding a wave of momentum courtesy of a big win in South Carolina. Amy Klobuchar and Pete Buttigieg suspending their campaigns has helped Biden consolidate, if you believe this, the moderate lane. And Klobuchar is expected to endorse Biden later tonight. So does that change things here at all? Here now in Santa Monica, senior politics reporter for NPR in Los Angeles, Libby Denkman, and Daily Beast contributor and host of Crooked Media's Hysteria podcast, Aaron Ryan. Ladies, thank you so much for joining us. Michael Bloomberg is still a wild card in this state and for the rest of Super Tuesday. Does he pose a risk for Joe Biden here?
I think that folks who might be watching this have probably been digging themselves out from the Michael Bloomberg mailers that have been arriving at their doorstep constantly.
Might have just seen a Michael Bloomberg ad in the commercial break.
Is very likely. Polling has not indicated that he is, in terms of posing a risk to the frontrunner Bernie Sanders, he's not there yet. He is hovering around the 15% threshold to get delegates in California. Statewide, you have to hit 15% of the total vote.
Yeah.
And then, of course, it's the 53 congressional districts, mini races in each one of those districts. Right now, Sanders appears to be the one who will take the motherload of delegates from California. And then the question is, will moderates consolidate enough around a Joe Biden, perhaps a Michael Bloomberg, to give them that boost over the 15% threshold?
Sanders is focused so much on minority voters, Latino voters in particular, especially here in Los Angeles, where young Latino voters are very enthusiastic, it seems, for Bernie Sanders. The older Latino voters, maybe not so much, and might be more comfortable with Joe Biden. What are you hearing? What are you seeing? What do you expect?
Well, I live on the east side of Los Angeles, and I'm
heavily Latino population out
yes,
there.
Exactly. And I'm seeing that the official uniform of the east side right now is a Dodgers hat and a Bernie sweatshirt. People are really, really excited. People are really motivated to support Bernie Sanders. And, people I've seen canvassing in my neighborhood are every imaginable demographic. I've seen young white people out canvassing for Bernie. I've seen middle-aged Latino people canvassing for Bernie. There's a huge rally for Bernie yesterday that was well attended.
Chuck D.
Yeah. If you take a look at Bernie's celebrity endorsements, they also run the gamut as well. And I think it's strangely reflective of his base of support here in California. You have Dick Van Dyke, you have Sarah Silverman, you have, all of these people who you wouldn't think would be all together in a coalition supporting him. So
he had Chuck D last night. He's going to go to Vermont on Tuesday and have 2 members of the band Fish.
Mm-hmm.
Those are very diametrically opposed in terms of musical taste.
Right. If I were listening to the radio and those bands came on one right after the other, I would be like,
what station am I listening to?
He's hitting so many demographics. He's hitting all the interest groups, whether you listen to Fish or Chuck D.
What are the issues here that have made his candidacy so appealing?
I think that, you saw a big poll coming out today from Univision and the Latino Community Fund in California. And while a lot of candidates assume that immigration would be the #1 issue that rises to the top for Latino voters, housing in California is up there. Healthcare is #1. You know, and I think Bernie Sanders has proven that consistent long-term engagement with these communities, where you have offices in the Central Valley, you have offices in Coachella, very heavily Latino areas, but you don't necessarily pander to, you know, a soundbite or two during a debate. You really do that long-term investment and
they're not
talking about
debate
those
watchers.
issues.
They're people that are focused more on issues and the outreach that a candidate might have had in a community. What about Elizabeth Warren? She's going to be in East LA today.
Well, she is. She's having a big rally today in East Los Angeles. I think that a lot of people who support Bernie, despite what you might hear and what you might see online if you're on social media, a lot of people who are supporters of Bernie are also okay with Elizabeth Warren and vice versa. I think it's a little bit less contentious than the narrative right now.
I've got a friend out here who says she's afraid to tell her friends that she wants to vote for Elizabeth Warren because they're all voting for Sanders and she thinks she's going to be screamed at.
Yeah, well, I think Warren
That's just one anecdote.
That's true, but we are, you know, we are in anecdotal land at this point because we don't know how any of this is going to pan out. I do think that Sanders and Warren both have an anti-establishment streak among their supporters, and I think that Bernie appeals to a lot of people in California because I think Donald Trump, to a lot of Democratic primary voters, doesn't represent an actual anti-establishment president. He is the establishment on steroids. And I think Bernie is actually somebody who promises to undo some of the damage that President Trump did, and he promises to undo it in the most explicit way. And I think Warren does it, but she's not as aggressive in her messaging with it. And out here in California, it seems like Bernie's message is taking root a lot more deeply.
Aaron Ryan and Libby Dankman, ladies, thank you so much for joining us. I appreciate it. 40 cases of coronavirus have been reported so far here in California. So what does that mean for both voters and poll workers alike as thousands head to voting centers tomorrow? With me now from Sacramento, California Lieutenant Governor Eleni Koulounakis. Lieutenant Governor, thank you so much for joining us. So what does it mean for voters and poll workers tomorrow?
Well, thank you so much for having me on your show. And I think there are a couple things that are really important for Californians to know. And first is that the Center for Disease Control is still rating the coronavirus risk to public health as low. Our own California Department of Public Health is encouraging people to continue to go about their daily lives, to not cancel public events. Obviously, that includes voting. And then, of course, to take the same kinds of precautions that we should always take during flu season, of washing our hands, practicing our elbow bumps, and not touching our faces to minimize the possibility of expanding through community association.
Let me ask you this. There are folks that might be nervous about going to the hospital, and we just had an epidemiologist on saying that you shouldn't go to the hospital unless you're feeling very sick. But those that are going to the hospital and are worried about medical bills, what do you say to them?
Well, first of all, the symptoms of coronavirus, as far as I understand them from our healthcare professionals, are respiratory. So if you have a stomach ache, it's probably not that. It's if you have trouble breathing, which of course you should immediately call 911 if that's the case. But some of the other symptoms, like Carl talked about, coughs and that kind of thing, I think that that's probably good advice, that we not flood our hospitals. But at the same time, you really do want to make sure that you take precautions. So if people are not feeling well, they should contact their healthcare provider as the first course of action. And if they are uninsured or not sure who to call, they can call the California Department of Public Health, go on our website, and find their local health department, and they can start there. So if it's not an emergency, but someone is concerned, that's really the first place to go.
Lieutenant Governor, are there discussions being had about how to cover the cost so that doesn't fall on uninsured Americans or Americans who can't afford a hospital visit?
Well, I think the main conversation is how do we make sure as a state that we are prepared? And being California, being such a large state with a high population, very connected to the world internationally, we have been preparing for about 10 years for something like this happening. So our Department of Health Services are coordinating regularly with federal health experts and agencies. We are coordinating regularly with local health care professionals and providers to make sure that we have the capacity to address this. So I think that that's very important. And the most important thing we really need to be thinking about is making sure that we minimize the impact to public health. And certainly how we cover the cost of it is also important to people. But if you're not well, you should call your healthcare provider and take it from there.
California Lieutenant Governor Eleni Kounalakis. Kalimera, Eleni. Thank you so much for coming on. And for the first time, California, I'm Greek too. For the first time, California is a Super Tuesday state. Also for the first time, the state is rolling out new voting procedures and brand new electronic voting systems. These changes have led to questions about election security and the integrity of California's primary vote. Joining me now here on set is California Secretary of State, Alex Padilla. Secretary of State, thank you so much for coming on. Talk to me about how California has changed voting for this primary.
Sure, and it's exactly for the security reasons that you mentioned. So all 58 counties are on track to have either upgraded or replaced their voting systems that meet newer, higher security standards precisely because of the security concerns in the elections world right now. They also happen to facilitate more options for voters throughout the state in terms of when, where, and how to cast their ballot.
Voting centers, right?
Well, 15 counties in California have moved to what we call the Voters' Choice Act, where any voter can go to any vote center in their county, convenient to them, over the course of 11 days. You know, you hear about early voting in other states. Vote by mail is very popular in California, but in-person early voting is, for us, a relatively new phenomenon, but one that's catching on quickly. So large counties like Los Angeles, Orange County, Santa Clara, Fresno, many others that encompass half the state's electorate started voting on February 22nd. Tomorrow's election day, technically, and many people have been waiting to see what happens closer to the date, but close to 4 million people have cast their ballot already.
I just talked to a voter who said that she voted for, cast her ballot early and voted for Pete Buttigieg. Does she get to vote again?
You cannot do it over again. You only get to vote once. The good news for her is all the down ballot votes still matter and still count, whether it's her member of Congress, legislative, local races, of course.
Are the voting machines here connected to the internet? Because when you talk to election security experts, they say that is the number one concern, and the number one, I guess, benefit is that most of the machines across the country are not centralized in one system.
Right, and when you talk to these voting experts and a lot of people on the Hill, they'll point to California as the gold standard. They have a number of policies in place that ensured our elections for many, many years. First, voting systems have to be tested and certified for use first by any county in California, and our state standards are actually higher than what the federal government will recommend. No, voting systems are not connected to the internet, prohibited by state law. The machine you may use to mark a ballot, to cast a ballot, or to count ballots. California requires paper ballots. Paper ballots in a voter-verified paper trail, and even then, we require every county to conduct a post-election audit after every election to ensure both the accuracy and the integrity of the results.
Are you ready if somebody tries to meddle with the voter rolls, which are connected to the internet?
Well, the great news, again, those are backed up constantly, and a great solution to that. First, we recommend to every voter to verify their registration status before going to vote, make sure everything's accurate and up to date, and even then, we have a catch-all. If there's any issues when you show up to vote, you can take advantage of same-day registration available at every polling place, every vote center in the state, or in the worst-case scenario, cast a provisional ballot. It may take us longer to count, but it will be counted.
Mr. Secretary of State, thank you so much for joining us. We appreciate your time.
Thank you very much.
Good luck tomorrow, and our live coverage from Santa Monica continues right after a very quick break.